We have Dr. Punit Agarwal, he is practicing in Delhi, and we also have the presence of Dr. Bharat, and he is practicing in Pune. Well, we're going to be talking about OAB and BPH altogether because these topics are very important and hold higher values for all the patients out there. Very welcome, both of you gentlemen.
Thank you, ma'am. Thank you.
So, we're going to be starting by Dr. Punit. Can you please describe our audience viewing this, that what is an overactive bladder, how we define it and what it is?
Overactive, usually the patient have more of frequency, like they present with the frequent voiding symptoms, and these patients sometimes have more symptoms in a day, or they can have a combined symptom where they have urgency and frequency both in a day and in the night also.
Okay.
So they have basically urge to pass again and again urine. That is the symptoms.
Well, why do you think the patients with overactive bladder, and what they do is they delay the consultation? What could be the complication when we are talking about it?
See, it impacts their social life. So every half an hour, every hour they have to go to the washroom. So that actually affect their social life, and with the time the symptoms aggravate. So early intervention or early addition of medicine usually help them, and the results are good. If they delay, the results are not that good.
Okay. So, Dr. Kumar, I would like to ask you, well, what role, we have heard the term as called behavioral therapy.
Yes.
How does that work? For the viewers who don't understand what is the term which is called behavioral therapy, would you like to define it?
Yeah, because overactive bladder has got a lot of psychological component also.
Okay.
Because as Colonel Punit also was saying, like some people do have symptoms more in the daytime but not in the night time. So if somebody has actually a problem of frequency and urgency, so most of the times they should be having in the night also. If somebody has got only during the daytime when they are awake, so that shows that there is some amount of psychological component also towards it. And particularly if we ask the patient if they are, when they are outside, they are most of the times able to hold. When they see the toilet, moment they see the toilet, they feel like going to pass urine. So we have to act on these things, which is part of the behavioral therapy. We have to tell them, try to postpone the voiding of urine, try to hold it. Normal voiding is around between 3 hours or so in a normal person. So we ask the patients to try and pass urine only after 2.5 to 3 hours. Try to hold the urine. And also, we ask the patients to do pelvic floor muscle exercise, which is called Kegel's exercise. That is also part of the behavioral therapy. And we do give pharmacological treatment, but when you do this behavioral therapy along with it, the response is long lasting, and maybe after a point of time we can try stopping the medicine also.
Right, right. When there is one particular thing which is called BPH, and the symptoms actually of OAB and BPH is quite similar.
Yeah.
So if a person is having the overactive bladder, he might think about an overactive bladder, but he might also be having BPH.
Yeah.
So how to say if I could be having both?
See, obviously BPH is in males only, and
of course.
so OAB can be secondary to benign prostatic hyperplasia because there are changes happening in the bladder secondary to the prostate enlargement because of the obstruction caused by it. So if it is due to a prostate enlargement, many times the patient will also have obstructive symptoms, like he might be having to strain to pass urine. To start micturition, he might have to strain, and then during passing urine there might be interrupted flow, as well as the flow of the urine might be weak. So, and after passing urine, patient might have the feeling that he has not passed the urine completely. So these are obstructive symptoms. So they might also be present along with the irritative symptoms of frequency, urgency, and urgency incontinence, increased frequency in the night, which is called nocturia. So these are mostly present in overactive bladder, but somebody who has got a benign prostatic hyperplasia, they might have these obstructive symptoms.
They may also
overactive symptoms comes late.
Okay.
So that is what I said initially. The early intervention is better in these patients because if in BPH the overactive symptoms are also there, and if we operate, there are only 50% chance that these overactive symptoms will improve.
Okay.
Obstructive symptoms will definitely improve, but there is only 50% chance that this overactive symptoms will improve. That is why we say these patients should report to us early.
So if in case, because we live in India and all the patients comes when it's too late. Now it's over the head. So what happens to those sort of patients and wait for the
late, they try their home treatments.
Yes, actually.
And peer group treatment,
Yeah.
whatever they advise, and then they come to us. Once these things fail and once they start wetting their clothes, then only they come. Till the time they are managed to hold urine in either way, they don't come to us.
All right.
Though once it become a social stigma, embarrassing in the family or outside, then only they'll come to us.
Right.
So
Well, do we need a surgical intervention when you're talking about BPH?
Yeah.
yes, it depends upon the severity of the symptoms.
Okay.
So if it's we have some scoring systems. If the symptoms are severe enough, or
Yeah.
if there are some absolute indications where there are definitive changes which has come up in the bladder or the upper tract that we call kidney and ureter, then these are the patient where definitely there is an indication of surgery. But in other group of patient, it depends upon the severity of symptoms. So
Right.
if they have grade 2 and grade 3 severe symptoms, then they are candidate for surgery. If grade 1 or some group of grade 2, we can manage with medicine and we can delay the procedure.
We can just ask them to reach out as early as possible, you know? Well, that was amazing having both of you on board with us. Thank you so much for your time.
Thank you. Thank you.
All right.